We continue Aches and Pains Week with important information on pain management. Here to tell us everything we need to know is Dr. Sampson Davis. Hey, how are you?
How's it going?
Listen, I'm of the age where everything hurts.
Oh,
you know, I wake
gosh.
up, my foot, my ankle, my shoulder. Tell us about when do you recommend pain medication?
Well, when you have aches,
Okay.
when you have pain. So there's, over-the-counter medication like Tylenol, which is also known as acetaminophen, and there's your ibuprofen, which is your non-steroidal anti-inflammatories. But it's very important, especially we were talking earlier about taking the NSAIDs, that you have to take it on a full stomach. So anytime
Yeah.
you take Motrin-like medications, you want to make sure you have food on your stomach.
Yeah, people don't realize it really hurts your stomach if you don't do that. So you have to have a full stomach.
Yes.
All right,
very
and what are
important.
the differences? Because I've heard acetaminophen, I've heard ibuprofen, Advil, Tylenol, Motrin. What are the main differences?
So you got to pretty much start with brand names versus generic, right? So
Yes.
it's just like the cars is a generic name, but you have Chevy, you have Ford, you have Audi. But with the brand name medications like Tylenol, which is known as acetaminophen, the acetaminophen is the generic. Then you move into your ibuprofens, which are your NSAIDs, your non-steroidal anti-inflammatory. But you will find ibuprofen in Advil, in Aleve, in Motrin. And then you have Excedrin. And Excedrin is a combination of 3 different medications, caffeine being one of them, salicylates, which is aspirin.
Which, that's important to remember. I've taken an Excedrin at night.
Yes.
Oh, yeah? What
No,
happened?
no, you can't go to sleep.
Is that what that was?
Yes,
Yeah,
and
it
I was like, what did I do?
Yeah.
But Excedrin may be great for people with headaches because the caffeine causes the blood vessels to constrict. But more importantly, to keep a diary, what works for you? So your aches and pains may be similar to mine, but each medication may have a different impact on how it works.
Are
for
there
you.
certain medications targeted for certain pains?
When you take a medication by mouth, right, it pretty much helps joint pain or muscle pain, but then you have topical medications which may be specific for certain pain. But again, knowing what works for you is important. Sometimes people underdose medication and then they don't get the pain relief that they're looking for. And it's dangerous also to take too much pain medication. So certain medications like Tylenol can impact the liver. Your Motrin, like your Advil, your ibuprofens can injure the kidneys.
Yeah.
So you want to make sure that you kind of dosing the medication correctly. So keep a diary is very important.
And not masking the pain too much, because then you don't know what's
going
happening.
on? How about topical gels, ointments? Tell us about that.
I like topical gels because it gets right to the root of the problem. And also, you don't have to worry about it becoming systemic, getting into your bloodstream. So like Voltaren gel is one that's really good for arthritis. It's the generic name is diclofenac. So you put it on your joint, it sort of absorbs the anti-inflammatory component directly to where the pain is versus going in your body, going through your digestive system and getting into your bloodstream. So over 32 million people suffer from arthritis. That's a huge number. And I have the same pain that you feel in the morning often as well, Mark. So it's important to make sure that you try a combination and keep that sort of information right at hand to know what works for you effectively so you can stay true to that regimen.
I think the cold plunge you did is good for arthritis,
Oh,
isn't it?
yeah.
Yes.
I think it's good for a
Yeah.
lot. It
Yeah.
really wakes you up. It makes you happy that you're alive, that you survived.
You survived another day.
How about
Woo!
alternative, things like cold plunge, alternative ointments like CBD?
Yeah, so CBD is now taking a huge impact. So CBD is what you find in cannabis, right? But it doesn't give you the highs. The THC,
That's
not
right.
the CBD, that gives you the high. But CBD is showing a huge impact in muscle pain, joint pain, and neuropathic pain, which is very difficult to treat. Neuropathic pain is that nerve pain you get, like sciatica sometimes you may feel is very difficult to treat. So CBD is starting to take flight, and a lot of people really are finding an impact of improvement with it.
Yeah, it helped my knee the other day. It was
Did it?
swollen. Yeah, it helped.
Yeah, I've had some that help too. Thank you so much.
Thank
you for
you.
coming. Come back and see us
I
again.
will, thank you.
Thank you, Dr. Davis, for all the information and more. Visit our website. We'll be right back with the inbox.